peace you planted, guide you through the day. Food that fuels your spirit, rest that keeps you whole. Wellness isn't pressure, it's a gift to your soul. Welcome to Health Corner. We flow with the rhythm of where your body. All right, thank you for joining us once again. Let me use this medium to welcome you to Health Corner, your number one program for verified health information. And this is the program designed for us to know better or more about our health. Like we do say on this program, that always prioritize your health. Your health should be the first thing, even before any other thing. Your health should be the first thing. Always concern or feel concerned about your health. On today's episode, at Corner, we have very important topic to discuss with you. Very important topic to discuss with you. And before I let you know the topic for today, let me firstly appreciate the Chief Executive Officer in person of the King Michael Adeboye Ashaolu, popularly called Omo Iya Alakara. And at the same time, I want to appreciate the man behind the console who is the one, the master brain of this production. You know, what you are hearing now, if not God and him, you won't be able to hear my voice clearly. Thank you so much. That is Balogun Abdul Samad. And on today's edition, I have, as usual, with me on the line right now, our nurse, Nurse Nwoko Ezenne. My name is Adenipekun Afolabi. Welcome you once again. Now, okay, let's go straight to the discussion for today. Nurse Nwoko, are you there, ma?
Yes, please. Yes, Mr. Falabi.
All right, thank you for always be online whenever we put call to you. We really appreciate you for doing that, even for the sake of many Nigerians who are not aware most of the things that we are we've been treated, and most of the things that we still treat on this program at Corner. All right, what we want to talk about is a common disease among a particular set of people. Why did I say a set of people? That it is not everyone that fall into that category, especially when it gets to the genotype. You know, from the genotype we have a series of genotype, but the one that we want to look at today has to do with a particular genotype, which is the sickle cell disease. That is what we want to talk about. Nurse Nwoko, for the sake of our listener, what exactly is sickle cell disease? You as a health practitioner.
Well, I can say that sickle cell disease is a kind of blood disorder. It's an inherited blood disorder where you have the red blood cell, instead of being the normal circle shape, they are sickle in shape. They are kind of curved in shape, and they become a bit hard, sticky, and cause a lot of pain because they are sickle in shape. They are not able to flow very well through the bloodstream. They cause a lot of pain, organ damage, anemia, and other complications. So sickle cell is just a kind of an inherited blood disorder whereby the red blood cell is affected. It turns from being circle in shape to being sickle, that's C shape in shape, and cause a lot of damage and pain to the person that has that sickle cell anemia. Thank you.
Okay, thank you for that beautiful response. You made mention something that is a kind of blood that someone hereditary. Is it? Are you now saying? I need clarification that. Okay, apart from hereditary, is there any other way someone can fall into this category?
Well, sickle cell is exclusively an hereditary condition. You can inherit it from your parents. You can't get it any other way. It's not transmittable. It's not infectious. It is an hereditary disorder that you inherit from your parents through their gene. When you have a genotype of AS and AS coming together, there's tendency of having SS is there, which is the sickle cell, or SS and SS. So that is it. It's not infective. It's not something you contact from touching somebody. It's something that you get from birth, from your parents, through their genes, their genotype. Yes.
Okay. Now that you said it is only single way or one way that someone can be inherit, it is true. When someone inherited it from his parent, that is only missed. Now, how common is sickle cell disease, especially in Nigeria?
Well, sickle cell is a very common disease, especially in Nigeria. In Nigeria alone, we have 150,000 babies every year born with sickle cell, and this is the highest in the world. So Nigeria has about 20 to 30% of people carrying AS, the genotype. That is meaning that they can pass the sickle cell disease to their parents, to their children. So Nigeria alone has 150,000 babies that are born with sickle cell every year. Then in the whole wide world, we have like 300,000 babies that are born with sickle cell. So you can see Nigeria has the highest, almost half of the whole world's number. So Nigeria has the highest occurrence, the highest epidemiology of sickle cell disease.
Okay.
Thank you.
With this, what do you think that contributed to the highest? I mean, this number that we have as a country. What do you think that contributed to the numbers of sickle cell that we have in Nigeria?
Well, I think it's ignorance and lack of information, and also lack of genetic counseling. Because before you get married to a spouse, you're supposed to go for normal blood tests, all the tests that you're supposed to do, premarital blood tests. We check your HIV, hepatitis B, C, genotype, blood group, and all that. So some people don't even know about all these things. So because of that, you see an AS person marrying an AS person. At the end of the day, they'll have one or two sickle cell children, and it keeps increasing. So it's lack of information and lack of genetic counseling that is a contributory factor, because most Nigerians don't read, they don't study, they don't ask questions, they are just ignorant of what is happening. That is why I think that's the essence of this, why our MD, our founder, is instituting this educational forum, because most people will not want to read the book where it is written. Because the white man say if you want to hide anything from a black man, just put it inside the pages of a book. So even with the advent of internet, some people find it difficult to even Google things. So as we are talking about it over the radio now, some of them that can listen will not grab what we are saying. So it's part of the enlightenment program. So I think with this one, some of them will be enlightened. But before the advent of this kind of programs, people don't read. They don't know what you're supposed to do. They're not health conscious. They don't know what they're supposed to do with their life, premaritally and even maritally. So that is the contributing factor. I think is ignorance is the major cause of sickle cell disease, because you can see it even among our elites. Somebody like Ikere Anunobi, an educated actress, she lost her baby due to sickle cell. So, but if they had premarital counseling, they would have averted that. AS would have married AA. At the end of the day, they will only end up having AS at the worst. They can't have a sickle cell, So that is it.
Okay, thank you. I want us to look at this. There's some that they are. It is not ignorance; it is deliberately. What I mean with this is that some people, okay, for instance, now someone who prayed about a partner, and what he received is that, oh, the partner is good for you, and both of them got married without going for, for test. That one is apart. But what of the person that even carry out the normal test, and from that, after the test, they still decide that, oh, they want to marry each other, that okay, there's nothing God cannot do. What do you say to this?
That is, well, it's not, they say faith without works is dead. When you have faith, you have to kind of confirm that they tell God to heal you of your own genotype so that you won't end up getting a child that is sickle cell anemic, So when they are exercising such faith, they've not asked God, because it's not every prayer that God answers. There are so many spouses out there that you can marry. It must not be that same person. And when they make such stubborn mistakes, at the end of the day, they are endangering the life of the babies they are bringing into the world. Because at the end of the day, they end up having sickle cell babies. And I know there's nothing God cannot do, but then you have to confirm first before you go ahead. If God wants to heal you, I heard some people saying that God healed them from SS to AA. It's possible. There's nothing God cannot do. But then you have to confirm that before you go into the marriage. Because if you say that you know that you are SS, AS, and your husband is AS or SS, and you want to dare God by saying you have faith, I don't know the kind of faith you are trying to exercise. Because at the end of the day, you come down with a baby with sickle cell. Most of them come down with a baby with sickle cell. Though I've had somebody giving testimony that they knew that they were SS, AS, and they promised God that they told God that they cannot have sickle cell, and it worked for them. That it worked for A does not mean it will work for B, because the level of faith of Mr. A might not be the level of faith of Mr. B. The level of relationship with God with Mr. A will not be the level of relationship with God with Mr. B. So you cannot say because you have God that you get testimonies and you stupidly and foolishly and blindly go and marry somebody that is SS with you. At the end of the day, you regret it. If your babies do not die because you don't have money, or even if you have the money, you will keep on spending it. At the end of the day, you'll be frustrated. That is if the baby can make it. But I thank God for the advent of new technologies. So if you have your money, you can make any of the decisions. Or it's your money that will determine how far the baby can go. Thank you.
It is the money that will determine how far the baby born as sickle cell will live. Okay, now before we come back to that aspect of financial implication of people who marry one another all in the name of love, that I love him and she loved me, and he loved me too, that is why we got married. And there are some people that I heard this from someone that sometimes ago. I have a discussion with people around me, and during our course of discussion, someone say that you may have the grace, even if you are AS and AS and you got married, that out of, even let us assume you plan to have 3 child, out of the 3 child you may have the chance of having the chances of having SS is maybe 1 out of the 3. Is this true? And they said that it may not be the first child and it may not be the second child, and if you stop at the second child, definitely you won't have SS. Is this real?
Well, there's some level of truth in it, but it's not a complete truth. The truth is that you have a chance of 1 out of the 4 to have a secular, but that does not mean it cannot come as the first child or the second child. It depends on the gene that cross-matches the husband's gene that match with the wife's gene. If it is the SS that match, you have a secular. But if it is the AS, you have a carrier. So it's not necessarily that it will follow a particular sequence. The thing is that there is a chances of having 1 out of 4 children that is a secular. So, but you can't risk it because you don't know which one it will be. There's also a tendency that all of them could be, because you might, just like I said, it's just a cross-matching thing. As you are giving birth, as the genes are forming, the babies are going to be taking the gene from the mother and from the father. So you can take from the father, you can have this baby and they will take this S from the mother. The next one will take the S from the father, and they will cross match, and they have a sequela. So you cannot say, you cannot predict it. It can come as the first, it can come as the second, it can come as the third. It doesn't have any particular sequence. It depends on the gene that got cross matched with the father and mother's genes.
Okay. How does this disease affect body of someone internally?
Say that again.
Okay, what I'm saying is that how does this disease, I mean the sickle cell disease, affect the body internally?
Okay. All right. It's actually a disease of, like I said before, the disease of the red blood cells. It affects the hemoglobin. Is a abnormal red cells. So when the patient have a sickle cell disease, what it means that the hemoglobin, the sickle cell, they are no longer the cells that are sickle. What I mean by being sickle is that instead of being round in shape, they are now like C shape, and as a result, they break down easily. And as they break down easily, they are not staying up to the 120 days that the normal red blood cell is supposed to stay. They will be causing anemia for the person. So, and as because they are C in shape, they are not round in shape, they cannot move easily in through the blood vessels, so they can cause pain. Then, because of this pain, because of this same shape and constant breaking down of this hemoglobin, they will cause spleen and kidney and lung damages. So, those are the things that happens internally when someone is a sickle cell disease, is a sickler, just to put it in a simpler form. Yes. So you can have things like anemia, pain, and organ damage, which are associated with sickle cell anemia. Thank you.
Okay. Thank you for that response. But most of you talked about the kidney and the lungs damage. Now, is this the causes of, most of the patients or people with sickle cell disease, they do have big tummy. Some of them, their tummy will be bigger a little bit than their body. Is this the reason for that big tummy?
Yes, because like I said, the hemoglobin is breaking down unnecessarily, breaking down so too fast. So as a result, because of those activities going on the spleen, that's what we call the spleen. The spleen is in the stomach. So you find out that the baby's stomach, the baby or the person's stomach become a little bit bigger than normal because the spleen is enlarged because of frequent breakdown of red blood cells. Thank you.
Okay, all right. Thank you for that response. And now, are there different type of sickle cell disease?
Yes, there are.
Okay, let's
You
have
have
it.
you have the HBSS, which is the most severe. That's the sickle cell anemia. You have the HBSC, you have the HB thalassemia, so those are the groups. It's just the way they are grouped. You have HBSS, which is sickle cell anemia. You have HBSC, you have HB thalassemia, just as the names imply. So they are just different types.
Oh, okay. With this, most of the people with this sickle cell, they always complain pains in their body. Now, apart from the pains, I want to ask, what symptoms do patients commonly experience apart from this pain?
Well, apart from the pain, they will have what we call fatigue and chronic anemia. Fatigue is severe weakness of the body. They have what we call jaundice. Like we talked about neonatal jaundice yesterday, because of the breakdown of red blood cells. So because their own red blood cells is also breaking down, they have their sclera and their skin stained with bile, which is the jaundice that they have. They're also susceptible to infection because they are vulnerable. Their red blood cells are no longer in the normal shape. They are sickled in shape. They break down easily, and it doesn't allow for good oxygenation and circulation, so they are susceptible to infection. Then it can delay their growth, especially in children. Children with sickle cell have delayed growth. They don't grow very fast because of their hemoglobin. Then we have what we call the leg ulcers. They can have ulcers. When they have wound, it doesn't heal very well because the red blood cells, in the red blood cells, you have what we call the the platelets, which releases thromboplastin during wound. So because the red blood cells are already damaged, they are already deformed, it doesn't produce enough platelets that will take care of their wounds. So they have ulcers that refuses to heal. Then they can have stroke or vision problem in severe cases. So these are the things that they can have apart from the severe pain. And the pain, we know it as a crisis pain. It can be frequent and all the time, coming all the time, because they are the sickle cell anemia, the sickling of the cells, the red blood cells, the breakdown of the red blood cells happens almost as frequent as possible, as often as possible. So they have that crisis, the pain, as often as possible because the breakdown of the red blood cells is also always happening frequently. Thank you.
Okay, all right. Thank you, Nurse Nwoko Ezene, for that beautiful response. Now, I want us to look at this. You know, this sickle cell that we are talking about. How is sickle cell disease diagnosed? If you want to diagnose it, how do we diagnose this disease?
All right. We diagnose it through screening. Especially during a child at birth, you can screen a baby to know this genotype. You know, that's what we call hemoglobin electrophoresis, the gold standard, another name for it. So you call it hemoglobin electrophoresis. Then you can do genetic testing. Then you can also do routine blood tests to monitor anemia and organ function. That can give you an idea that something is going on like a sickle cell. So you have a newborn screening, you have hemoglobin electrophoresis and genetic testing, and also routine blood tests that will point to anemia and organ function tests. So those are the things that we do to find out or diagnose sickle cell anemia.
Okay, all right. Thank you for that beautiful response, Nurse Nwoko Ezene. Now, is there a cure for this sickle cell, and how do patients manage it daily?
All right. Recently there is a cure, but before we get to that, I would like to mention some things that can trigger this painful crisis or sickle cell crisis. Something like dehydration, cold weather, infection, stress, overexertion, and low oxygen levels. So for you to take care of these things is to manage all these things I just talked about. How to take care of these patients on daily basis is by making sure they are taking enough water, so that water will help to flush the system. It will help to make the sickle cells to move freely in the bloodstream, thereby releasing the pain. Then they should be taking folic acid, the small but mighty medication I talked about yesterday. Then they should avoid cold and stress. It's very important because in cold and stress will aggravate their symptoms. Another thing is making sure they take all the vaccination they need to take. All right, there's another drug known as hydroxyurea. They use it to increase the fetal hemoglobin. Then they should treat their pain promptly. Once the pain starts, they should go to a health center and make sure they are being taken care of, so that they won't have, because the pain can be very aggravated, they can be very painful, it can be very severe. Then they should not play with their hospital checkups. They should be regular with their hospital checkups. So as for the cure I talked about, there's what we call the stem cell transplant or the bone marrow transplant. It's a permanent cure for sickle cell. In fact, I have a classmate who is in the United States of America now. The first time I spoke with her, She told me that because she's a secular, right then in school, she was always battling with the problem all the time. So recently, she told me that she was able to go for the bone marrow transplant, and she's no longer a secular now. And I was so happy for her. So the science has advanced so much that recently we can do a bone marrow transplant, and that will be taken care of. So that is why I talked about the financial aspect of it. So and I know it costs a lot of money for any mother of parents that has money, that say that their love is killing them, they should keep their money ready so that they won't bring a child and make the child to suffer. They should make sure they have money for the love.
What you mean is that if someone wants to marry AS, maybe if AS want to marry AS all in the name of love, they should get ready to spend their any income. Is that not what you are saying?
Yes.
Oh,
yes.
But instead of someone spending his or her any income unnecessarily, I think the best way is just to be on a safer side. Now, with this, is there any recent advances in treatments?
Yes.
Okay.
There are different advances in treatment. Just like I said, there's what we call the gene therapy and the CRISPR gene editing. The CRISPR gene editing means using something like a GPS to cut the genes, to cut off the sickle cells and from the gene, thereby curing it from the gene. Also the same thing with gene therapy. You kind of start to treat the genes that are responsible for sickle cell. So, but it's also expensive. It's a new advancement apart from bone marrow transplant. All these things are new developments that has been in vogue this time around. So, sickle cell now is not something that cannot be curable, unlike the 80s and the 90s, where it was not curable. In this millennial age, things like bone marrow transplant, gene therapy, CRISPR gene editing are now things that can be done to offer hopes and better long-term outcomes. There are also some drugs that are known as crizanlizumab, and G and L-glutamine. They can also be used for the treatment. So all these treatment now gives the sickle cell patient hope that something good can come out of their life, especially if they were married in the 80s and 90s and they are still alive up till now.
Okay.
So there's a hope for them.
All right. Thank you, Ma. I want to saddle you with the responsibility or with the duty of a guidance counselor now. I want you to, for the couple who are planning for their family, what step can they take just to avoid this sickle cell disease that we are treating today?
All right. The first thing and foremost thing is to go for genetic counseling. Genetic counseling is very important. Then, in case if they do not know and they got pregnant, they get married, there is what we call prenatal diagnosis, such as amniocentesis. When they do it and they find out that the baby has sickle cell disease, they can decide whether to terminate the pregnancy or to continue. That is if they have the money and if they have the information, So that is it. So genetic counseling, prenatal diagnosis, these will inform the parents to know whether to undergo the risk of taking care of a sickle baby or to terminate it or to prevent marrying themselves at the same time. So, but the thing is this, I would like to talk about the steps they should take during the genetic counseling. If a partner is AA and if a man is AA and the wife is AS, it is safe. They can marry. At the end of the day, at most they have a one chance risk of getting a carrier. But if they are AS and AS, it is a high risk. It's a high risk. They should avoid it because there's a tendency that they can have 1 out of 4 children as a secular. Or even if they are not lucky, they can be having seculars, you know. So it's a high risk thing. So, but if they marry, another thing is AS and SS, or SS and SS. That one is a very high risk. That one definitely you are going to be having secular. You know, so that is it.
Okay.
So
You made mention of maybe terminating the pregnancy if they are aware, maybe after pregnancy, they now aware that okay, they are ASAS, and this you talked about biblically, it is not allowed. But are you now saying is this relates to the mercy killing as far as the earth practitioner is concerned? Because I know of what they call mercy killing. Do you want, is this part of the mercy killing that the medical people are saying? Because I don't get you right. I want to understand it better.
all right, mercy killing in medical terminology is a kind of a way of alleviating someone's pain. It's usually done with people with cancer, whereby they give the consent of, maybe without their consent, a nurse can kind of terminate their life, kind of kill them, or the doctor can go ahead and prescribe instead of allowing the person to undergo unnecessary pain, excruciating pains that no medication can take care of. So this termination of pregnancy in sickle cell disease condition is not necessarily mercy killing, because they are not in pain. They're only trying to prevent an occurrence that will occur in the future that will sap them of their money or keep the child in pains, or make the child have a dramatic life, you know. So mercy killing is just the terminology given to the proper killing of a patient that is in pains due to cancer or any other traumatizing condition that causes a lot of pains that is unbearable.
Okay.
So that is it.
Okay. With what you explain now, that means we need to undergo what we call the abortion. Is abortion legalized for medical practitioner to carry out?
Well, yes, for some countries it's legalized, and in some cases in Nigeria too, if a mother, like if a pregnancy is a high risk and is going to take the life of a mother, we do what we call is allowed to do termination of pregnancy. We call it termination of pregnancy, you know. So that is it. So
Okay,
it's not a crime.
do we have experts in this field who their duty
Yes,
is to terminate?
yes, there are.
Okay. All right. Now, because of our time, now your final advice for, general advice for people who are watching us right now, even for the family that they have 1 or 2 sickle cell child in their home, and for those who want to get married, who want to establish their family, your general advice for everyone.
All right. My general advice to everyone is that sickle cell disease now is manageable. You know, even if you are born in the dark age and now you are not aware of what to do. Like I said before, make sure you drink a lot of water. Don't stay in a cold environment. Even if you're in a cold environment, try to cover yourself very well. Drink a lot of water so that you can help your system to be your vessels to be the blood to be flowing very well in your vessels to avoid pain, crisis pain. Then make sure you avoid stress. Unnecessary stress, you should avoid it because it can aggravate your condition. Then for couples that are yet to get married, they should go for genetic counseling. If they find out that they are SS and AS, they should quit and look for another person, you know. But if they cannot, if they feel that they love themselves so much, they should know that it will entail their money, because bone marrow transplant is not a 1 naira thing. It runs in millions of naira, if not dollars, you know. So please, my advice is that go for your genetic counseling so that you don't bring in a child that is that has sickle cell disease. And after bringing the child, you don't have money to take care of that child. It will be painful. You will be in agony, and the child will be in agony. And it's not good that you watch your own child die. You bury your own child. It's not a good thing. So my advice is that please go for genetic counseling. And if at all you already have a sickle cell baby, due to your lack of knowledge or ignorance, do take care of them. Do proper management of your baby, of your child, through what I've just told us, by drinking enough water, staying out of cold, and reducing stress. You know. So please, and also try to read, try to study, try to read, like all these educative information, try to listen to them and apply them, and see that it will be of benefit to you and your family. Then for those of you that have money, there are enough options for you to go for. I'll talk of gene therapy, CRISPR, uh, uh, CRISPR gene editing, you know, and also bone marrow transplant. So all these things you can do them if you have your money. So, but there's no point making money and hoping to go and waste it. If you can actually look for a partner that is AA, if you are AS, it will be the best. But if you cannot, I think you should keep your money. There's always a way out this time around. Science has advanced, and people with sickle cell anemia are no longer it's no longer a death sentence. It's something that can be curable right now. Thank
It is
you.
not a death sentence like before. Hmm. Okay.
Yes.
Thank you, Nurse Nwoko, for enlightening us on today's topic, that is sickle cell disease. I believe to all our esteemed viewer, we've understand what sickle cell disease means, and I believe you've gained one or two things, that don't because of love, because of something that you later regret of. Getting married to one another, if you are AS, do not marry to AS. But if you are AA, you can still marry with AS. And if you are AS, don't ever think of getting married to SS, or SS marry each other. That is no going area. On this note, we are
Yes.
going to call it a day on today's edition of your program Earth Corner. And many thanks to the executive producer in person of Deacon Michael Adeboye Ashaolo, and to the man behind the console, Balogun Abdusamad, and to all the esteemed staff. We are saying thank you for watching to the end of the program today. Nurse Nwoko, from here I'm saying bye to you.
Bye, Mr. Falabi. Pleasure being with you this evening.
All right, till tomorrow. Thank you for your time. My name is Adenikpekun Afolabe. Let's do it again tomorrow. Tomorrow it's another day. From me, I'm saying to you, your health is your wealth. Always prioritize your health, and don't take your health for granted. Take your health first, and it should be your concern. Till tomorrow, I'm saying bye for now. Stay healthy.
Settle into gentle pace. Sip your water slowly, let your body wait. Little healthy steps are the choices you make. Stretch into the morning.